Good afternoon, ladies and gentlemen. This is Jared J. Wallen, MD, with You and We Urologic Surgery and Wellness. We're coming to you live from sunny Sarasota, Florida. And today we're talking about enlarged prostates, benign prostate hypertrophy, BPH, benign prostate hyperplasia, lower urinary tract symptoms in the male. These are all kind of common things that are kind of tossed around and essentially are kind of the same. So again, enlarged prostate, BPH, benign prostate hypertrophy, benign prostate hyperplasia, and lower urinary tract symptoms in the male patient. Ultimately, a lot of these things are very, very common. Up to 50% of men may have some symptoms of any of these problems. Again, we'll just kind of call it BPH from now on. Again, up to 50% of men have BPH symptoms over the age of 40. What does BPH mean? Essentially, if this is the male pelvis, you can see the penis here, the testicle, the prostate gland sits right below the bladder here. This is the seminal vesicle. This is the bladder on the top, and this is the rectum on the backside of the genitalia. Again, this little prostate gland sits right below the bladder. The little urethra tube runs right through the middle of the prostate as well as the penis. And essentially, that's the little tube that men urinate through. As we get older, this little prostate gland, it continues to grow our entire life. And the problem with that is that the prostate gland is the deepest thing in the pelvis. And so you can see here, there's bones on the outside of the prostate gland. There's just not a lot of space for it to grow and branch out like a tree does. And so essentially what happens is that this little tube basically gets squished, and that causes, essentially plumbing issues like urgency, frequency, high pressure voiding, having to strain, nocturia sometimes. Sometimes it can cause urinary tract infections or the need for a catheter, urinary retention. A large variety of different presentations can occur, and ultimately they all are due to this little prostate gland being enlarged. Now, obviously, there are a multitude of other different things that can cause lower urinary tract symptoms in the male patient, and ultimately, I would refer you to my blog about benign prostate hypertrophy and lower urinary tract symptoms, which I'll copy the link in the text of this video. On YouTube, so that way you can see it and read about other types of things that can cause lower urinary symptoms similar to BPH, but not necessarily BPH itself. For the purposes of this video, we're talking again about this little prostate. Ultimately, there's a multitude of different things. The most common thing that can help with prostate issues is a medication called Flomax, which basically just relaxes the muscles around the prostate gland here and allows the urine to flow through the system easier. That's a very common medication, although some men don't necessarily love that medication because it causes the ejaculate fluid, which comes from mostly the prostate and the seminal vesicles, and a little bit from the testicle, the sperm. It causes that to kind of go retrograde back into the bladder rather than out the end of the penis, because the path is longer, and when we relax the muscles in the prostate here, it's much easier for it to go backwards rather than forwards. And so that's one common medication that can help. There are some other medications out there, and so from that standpoint, that's good for mild disease. If you're having minor symptoms, not a big deal. Certainly what we know is from the AUA symptom score survey, if you take Flomax, it should drop your survey score about 4 to 6 points. And we know that a good quality of life change is about 4-point decrease. And so you can see again with mild disease, not a big deal. If you have more severe problems, ultimately then a lot of times you may be looking at having some type of procedure done for your prostate. And that's what we're talking about today. We're talking about prostate procedures that can help you urinate better to cure your benign prostate hypertrophy, lower urinary tract symptoms, enlarged prostate, etc. And all of those procedures are essentially geared towards basically increasing the diameter of this channel through the prostate, so that way urine can flow through there much easier. There are 2 of them that can be done in the office. They're considered kind of minimally invasive. One is essentially called the UroLift procedure, which basically puts little tacks in the prostate tissue to kind of hold the curtains open, so to speak. One is a little steam procedure, which is directed by a little needle that goes into by your surgeon. by myself, and that basically treats steam treatment to the prostate tissue on the inside lining of this channel. That basically kills the tissue. Over a period of time, about 4 to 12 weeks afterwards, the body's normal processes reabsorb that tissue, and then the channel widens out and becomes bigger for you to be able to pee through easier. There are a multitude of other surgeries, one of which is I typically reserve for large prostates or men who are on anticoagulation, blood thinner medications, or if you have a really big ball valve, which is really just a different architecture of your prostate. We'll talk about the diagnostic procedures that are necessary before a procedure here in a second, but basically it's similar to the other two that I mentioned. Again, the whole goal is to increase the diameter of the channel through the prostate, but basically it's just a procedure that's done in the OR, and a laser is used to kind of basically widen out and remove and vaporize this tissue. If the prostate's really big, sometimes people will do either a robotic or open simple prostatectomy. Quite honestly, in my practice, I think that either UroLift, Rezum, or the green light laser can solve almost probably 95% of prostate issues. And again, the beauty of that is that means that they're all outpatient management. You go home the same day, you get to sleep in your bed, you don't have to spend a night in the hospital. For that reason, it's less cost, and certainly, obviously, good for everybody. Provided we can get the same results, which we absolutely do. For any of the procedures, especially the Rezum or the green light laser, we expect about a 50% reduction in your symptom score and about a 50% increase in your urinary flow stream rate, which typical flow stream rates for most men should be around 20 milliliters per second or better. We tend to see they kind of drop down below 15, below 10 for guys who have voiding symptoms related to the prostate. And so we see that jump back up after we open up that diameter of the channel to make it much easier for urine to flow through. The only other thing I want to mention is that UroLift, it can be as effective as those other two, about a little bit less than a 50% reduction in the survey score. There is some data out there that says it might not be quite as good of a reduction in your symptoms, but still very effective. And thankfully, when it's done in the office, can be a very nice way to be a minimally invasive approach to, fixing your plumbing problem while still preserving other functions. That brings me to the next thing to mention. I mentioned that retrograde ejaculation before with Flomax. That can be a potential outcome of these types of procedures. Anytime you mess with the prostate tissue or the prostate channel, that can cause retrograde ejaculation. However, the Rezum and the UroLift are less likely to have that problem. Quite honestly, I think by and large, most patients, there is some historical data that shows some erectile dysfunction issues, but unless we're really coring out the prostate to where we get to almost the outside of it and start to irritate the nerves, there really shouldn't be any new erectile dysfunction problems because of this type of procedure. So what do you need to have done before this type of procedure? Well, basically it's 3 diagnostic tests that would be done in the office. And the first one is essentially, I mentioned that flow stream score of 20 milliliters per second being the standard, the kind of the quote unquote normal for most men. Typically you would basically just come in with a full bladder and pee into a jug, and that jug measures how strong your stream is and how long it takes you to void and this type of stuff. And that gives us more information about that. The other 2 tests that are done are really to determine the size of your prostate as well as the architecture of the inside of the prostate and the channel. One of those is a little camera that goes up into the bladder and looks at the inside channel of the prostate as well as the inside lining of the bladder. And the other one is a little ultrasound that's done to determine the size of the prostate. Ultimately, those 3 tests, again, can be done in the office, and those are the main determinants of what type of procedure would be best for you. I hope you enjoyed this video. Thanks so much. Again, Jared J. Wallen, MD, board certified urologic surgeon and men's sexual health specialist, UNW Urologic Surgery and Wellness, Sarasota, Florida. Have a blessed day.
As you can see listed here are our websites, unwe.com, as well as our YouTube, Facebook, LinkedIn, and Twitter pages.